Hi, good afternoon. I'm Michelle Grzoulis, and I'm president of Rochester Regional Health Foundations. And I'm so happy to be here today with Dr. Eugene Toy, the chair of obstetrics and gynecology at Rochester Regional Health. And we're here today to talk to you about cervical cancer because this is Cervical Cancer Awareness Month. So, Dr. Toy, thanks for joining me.
Thank you for having me.
Happy to spend some time talking with you about cervical cancer. So let's start with the basics. What is cervical cancer?
So the cervix is the entrance to the womb, and cervical cancer is one of the most common gynecologic cancer in reproductive age women, so particularly of significance and reproductive women that, age women that are seeking fertility or planning fertility.
So what tests are available for cervical cancer?
So the evolution of cervical cancer screening has gone from the advent of the Pap smear, which is in the mid-1900s, to more modern molecular techniques for detecting what we call the HPV, or human papillomavirus.
Okay. So when we think about testing for it, I mean, oftentimes people think, well, what's my risk factors? So what are the risk factors for cervical cancer?
Because cervical cancer, and precancer for that matter, is really related to this HPV virus being the necessary cause, we know that any risk factor related to early sexual intercourse or the susceptibility of the cervix to infection, all of those things play a role. We know that smoking is a risk factor that continues to be even later in life, but is one of the most modifiable, or probably the only modifiable risk factor for cervical cancer.
So is it the sort of thing that without the invasive testing or the internal testing, there's no really signs for cervical cancer, or what should people be thinking about as they think about, hey, could that happen to me?
Correct. Unfortunately, the best detection of cancer, or really the avoidance of cancer, is with screening tests. But if it happens to cause symptoms later on in the development of disease, you would see bleeding or menstrual irregularity. In more advanced disease, can be associated with pain, particularly in the pelvis, or any disturbance in bladder or bowel function. But that's usually pretty advanced cases of cervical cancer.
So the general rule would be make sure that you're getting your screenings on an annual basis?
Absolutely. Either your primary care physician, or for younger women, their pediatrician will many times initiate screening at the age of 21, or for adult women who see a gynecologist. Those are the ones that are the subject matter experts.
So before we talk about treatments, I want to come back to this HPV discussion. So I know in the last 10 years I hear more and more about HPV and the link to cervical cancer. What's the general guidelines that you provide to your patients around who should get the HPV vaccine, boys, girls, both? Just talk a little bit about that.
So in general, the human papillomavirus vaccine is a preventative vaccine. In other words, if you've already had exposure to a particular strain of HPV, and the vaccine is given that really is to prevent that infection, you're not going to receive protection. But if you have not been exposed to that particular strain of HPV, then the vaccine will be effective. Because the vaccine covers several different strains of HPV, you might have exposure to one strain but not the others. But in general, we try to vaccinate at an early age so that these are what we call HPV naive, either boys or girls that have not been exposed to the virus already.
So for parents who might be watching or listening, what's the age that they should anticipate the pediatrician talking to them about that?
We like to have this discussion before the age of sexual debut, which is around 11 or 12. And the indication does go up to age 26, but in immunocompromised boys or girls, that even goes down to age 9.
Wow. Wow. A lot younger than people would think.
Yes.
Yeah. Okay, so let's talk about treatment. So for women who are diagnosed with cervical cancer, can you help us understand a little bit about how you approach treatment and what options are, and educate us on that?
So really the importance and why we're here today in Cervical Cancer Awareness Month is really to diagnosed in the pre-invasive disease, and that after initial screening with a pap smear or HPV test will be an office visit that will encompass more detailed evaluation of the cervix, what we call colposcopy. Now that can detect cervical cancer at the earliest, what we call microscopic disease point, but if there is more obvious disease like a tumor mass, then that is up to the specialist, the gynecologic cancer specialist, to really decide the best modality of treatment.
Okay. So it's also helpful, I think, for particularly women listening to know that you get a abnormal pap smear, that doesn't mean that you have cervical cancer.
Correct.
Yeah.
It is only a screening test, and there are many degrees of abnormal pap results, and that's where the education part from your provider will give you guidance in order to know the next step.
Okay. I didn't mention it when we started, but if you have any questions or want to ask any questions, feel free to write them in, and we'll make sure that we ask them of Dr. Toy.
I do have a question right now.
Okay.
What are the odds that I've been exposed to an HPV strain, or several strains? How old, when you don't need to think about this, or when is it too late to be thinking about this?
So really, the human papillomavirus is so prevalent among sexually active women that even exposure to two lifetime partners probably puts you on the risk of having HPV over 75% risk.
Great, thank you. So what are things, you've talked a little bit about, obviously, sexual activity. Are there other things that people should think about doing to prevent or reduce their risk? You talked about smoking as one. Other things that we should be thinking about to reduce the probability or chances that we get cervical cancer?
I really think that's the education part of it. I mean, part of this dialogue today is really to get that message out in Cervical Cancer Awareness Month. It's not in this day and age really still as open a topic as we would hope it could be in terms of women's cancer in such a sensitive nature, such as the lower genital tract. But as we know, the impact of the pap smear back in the 1930s, 1940s really was combined with education, awareness, and the removal of that taboo that women's cancers were something that should not be spoken about. We really have to be conscientious, we have to be educated, and we have to advocate for one another to really speak on the medical side where the education can be most powerful.
And it sounds to me like, given the host of symptoms that you said someone could have, right, those could be symptoms of other things as well. So it sounds to me like your advice would be, if you have a concern and something doesn't feel right, see your provider, and either by way of a pap smear or some other type of an exam, we could see if something's going on.
Correct. And really, again, this is such a important diagnosis, and knowing that you have pediatricians, primary care providers, either family medicine or internists, as well as gynecologists that are experts in this field. Those conversations can be very private but very open, and they can lead to timely diagnosis of what we hope is a pre-invasive disease, because those are treatable conditions to really prevent any development of invasive cancer, which we know is not common, only about 13 to 14,000 cases in the United States a year, but still a significant cause of mortality, about 4,000 deaths a year predicted in 2018.
Say that again, the 13 to 14,000 is the number that actually become invasive cancers from cervical cancer?
So the incidence of invasive cervical cancer in the
Okay.
United States is
Okay.
around 13 to 14,000.
Which is actually not that high.
Yes.
Really, surprisingly. I want to go back to risk factors. I didn't ask this earlier. Is there a genetic component to cervical cancer, as there is with other forms of cancer, where you could look to your parents or my female mother and say, hey, she had it, I have a higher increased risk?
As of now, we don't really have a clear genetic link. If you look at the necessary cause, which is a infectious virus, the HPV virus, really, anything that would make you more susceptible to that could very well be something inherent to your makeup, but it's not something that we can say, oh, this mutation leads you to have cervical cancer, much like other breast or ovarian cancers, which we as gynecologic cancer doctors speak to. But we don't have a blood test or a genetic screen at this point in time for any cervical cancer.
So
forgive me if you've answered this already, but someone did ask, what % of HPV positive turns into cervical cancer?
So the large majority of women that have even some milder, it's actually quite the opposite. So the immune system really does very well to clear even high-risk HPV, but it's important to distinguish high-risk and low-risk HPV, which is what the molecular testing does now.
Another question, Phil, or can I want to build on that one a little bit. So from that, I would think that the other message here is, if you're someone who at some point has had a positive HPV test by way of a pap smear, that really focusing on also building up your immune system is also one way to help strengthen your body's ability to fight that?
Yes, I mean, that's hard to quantitate.
Yeah.
We know that the reproductive tract, the lower genital tract, is somewhat sequestered in immunoprivilege, so that we don't necessarily see the same immune defenses that we do for the rest of the body.
Yeah,
but
that's
that
true.
being said, what we can do to continue to live healthy and eat well, get enough rest and exercise, that's all going to speak to your overall well-being there. But knowing that smoking and the carcinogens associated with nicotine are actually secreted in cervical mucus makes that a direct link and risk factor.
Interesting.
Yes.
That's very interesting. So what I've gleaned so far from what you've shared with me is testing is happening at a younger, the vaccination should be happening at a younger age for HPV, but that's something that a parent or patient should talk to their provider about in terms of sexual activity and when that's appropriate. People should make sure that they're getting their pap smears, because this is a treatable form of cancer.
And to be a little bit more clear, the pap smear has evolved, as I mentioned, from the 1930s, 1940s, to where it is now a co-testing of pap as well as molecular testing. So the traditional pap smear has evolved to where now we can look at a liquid and the cells as well as test for the virus all in one. And
So
this
more robust.
is quite an advancement in screening, but what we've also learned that age 21 is really the acceptable standard to begin testing. That before age 21, the large majority, even of exposed young teenagers, will clear the virus.
Okay.
For those that tuned in late, can you just explain what HPV is, and is it a sexual disease?
The human papilloma virus has many forms and many strains, and some of them are associated with the skin, some of them are associated with the reproductive tract, but the ones we're talking about are specific to lower genital tract infection, which is transmitted by intimacy and intimate contact.
Great. So back to sort of the summarizing. So talk to your provider about when vaccination should occur, get your annual pap smears, and recognize that they're detected early, lots of treatments and opportunities to prevent the disease from advancing.
So yes, again, to qualify, the pap smears are not necessary every year, and again, this is the some of the guidelines that are very subtle and that your provider can speak to, because it depends on whether or not you're depending solely on looking at the cells themselves or actually the strains of HPV. So depending on what you're testing and the results of those will dictate, how frequently you need to have a pap test and HPV.
Great. Any other questions online? Great. So anything else you think that we should have covered that we didn't cover to enlighten the audience on Cervical Cancer Awareness Month?
Really, as we spoke to, to be open about this. This is a highly preventable disease, but even in the early stages that I deal with, highly curable. So we really want that awareness to be spread and within families, and educating those that we know to see their doctors and to follow up on their recommendations.
I think what you said before is really true. It's almost about removing the taboos and talking about what might be uncomfortable but yet important, because like most things, it's early detection, early cure.
Absolutely.
So thank you, Dr. Toy, for spending time with
My
us.
pleasure.
And thank you for joining us. Have a great afternoon.